Okay, so Reach was introduced about 5 years ago as a sort of way to try to make people more competitive when they were applying for things that lots of people want to do, like Oxford and Cambridge, and also initially including medicine and dentistry. But eventually we realized that basically the journey that you're going to have to go on is so different from the journey that like people doing, Oxford science or whatever are going to have to go on. That having you all in the same room was kind of silly because the things that you're going to have to worry about and make sure that you've got sorted out are very different from what they're going to have to do. So that's why we created this separate section. So really, the purpose of today is mainly going to be to just make sure you're in the right place, essentially, because it's really important that you've thought about this fact that you want to do medicine or you want to do dentistry or whatever, and that you haven't just kind of drifted into it, because it's a massive decision to make. Because effectively you're kind of signing up for life effectively by doing one of these courses. I mean, obviously you can get out of it if you want to, but generally people don't. I mean, normally once you go to medical school, that's it. You stay in there and you become a doctor and stuff. So you don't want to drift into that because, as we'll talk about today, it's not going to be an easy ride. And so you want to make sure you've thought about it properly. So that's really what today is going to be about. And sort of just sort of apologize in advance that it's going to be a bit of a downer because I'm going to focus mainly on the negative things, because I'm assuming that you're all kind of excited and positive about this decision that you've made, that this is what you want to do. And so what's important is that you balance that with a bit of realism about what the downsides are. So we'll focus on those. And I'm not trying to put you off. I'm absolutely not trying to do that. If you all decide you don't want to do medicine and dentistry, then I'll be out of a job. So it's not in my interest to put you off. It's just that I don't want you to drift into it and regret it later when it's kind of harder to get out of it. It's much better to have really thought about it at this point and make a properly well-informed decision. The other reason it's important is that when you go for interview, because you don't get onto any of these courses without being interviewed by the universities that you applied to, and when you go there, they're very likely to ask you, why do you want to become a dentist? Why do you want to become a doctor? And if you just say, oh, I haven't really thought about that, then immediately you're going to be rejected. Yeah. Yeah. Okay. Ah, right. Okay. So if you email your personal tutor, they will put you in another group, and you'll only have missed the first one, so it's no big loss. But yeah, so you don't feel you have to stay. And but yeah, email your personal tutor, and they will sort it out. No problem at all. um, but yeah, sorry, is everyone else kind of okay? I should have checked that at the beginning, really, shouldn't I? But so yeah, what was I talking about? Yeah, they'll ask you, why do you want to be a doctor? And you can't say I haven't thought about it, and you can't say either, oh, it's just what I've always wanted to do, since I was a toddler, because they'll want you to have thought about it. Obviously, when you're a kid, you want to do it because it looks cool on Scrubs or something like that, but they want you to have thought about it more deeply than that, and to have made a positive decision that you want to do it in spite of the fact that there are some serious negatives that you have to take on board. So that's what we're going to focus on today, and then we'll get much more positive after this week and focus on what you basically need to do to get in. So that just summarizes that. So this is what you're missing. So this is what you would get if you went to the mainstream Reach that most of your sort of non-medical um, friends may be going to. So just very quickly to run through the sort of stuff they'll be talking about. So is university worth it? That's looking at like earnings and stuff, and what difference it makes going to a good university. Ways to find out about courses, that's really important, because that's the big theme there, is that they're assuming that people haven't really focused on exactly what it is they want to do. And that tends to be the difference here, that you probably have decided exactly what you want to do. So there'll be a lot of time that they'll spend finding out about courses. Traditional degrees via apprenticeships, that's because the landscape has changed. 10 years ago, if you wanted to get to a high level in almost anything that was sort of vaguely academic, you had to do a degree. But now, for anything that's a little bit technical, degree apprenticeships can be almost a better way forward. They did try introducing them for medicine. There was a plan to have some doctors trained via an apprenticeship route, which was hugely appealing because, you know, the way you're going to have to do it, the way everyone has to do it at the moment, is that you go to medical school and you pay them 9,000 a year. If you're on an apprenticeship, they would pay you, and you don't pay them anything. So it was, you know, everyone was kind of excited about those, but they were very controversial. And when the present government came in, they just scrapped the whole thing. So there is no apprenticeship route for you, I'm afraid. Oxford and Cambridge, well, we'll talk about that as well. If you're a dentist, don't worry about it because they don't do dentistry, but for medicine, it is an option. And then again, they'll talk a lot about the fact that you have to read huge amounts around your subject. So if you're going to, you know, apply to do physics, you'll have to know about areas of physics that are way beyond the A-level syllabus. That's not true for you. I mean, if you want to read about the sort of science behind medicine and recent medical advances and stuff like that, then great. I mean, I'm absolutely not going to discourage that, but they're not going to be interested in that in the application process. So again, I'm not going to talk lots about it because it's not massively important for you. And then critical thinking, admissions tests, that's massively important for us, but ours are very specific admission tests. So again, the general stuff that you get there wouldn't be helpful. You need to know about UCAT, which is the main gateway to getting an interview for you. For both medicine and dentistry, you can't avoid it. All the medical schools, all the dental schools use it. If you don't do at least tolerably well, and for some medical schools incredibly well, you won't get interviews. So that's going to be important. Personal statement used to be the single most important thing. So when you put your applications in, you have to write this one-page thing about why you'd be good at being a doctor or a dentist and show off your understanding and your sort of self-awareness and that kind of thing. These days, increasingly, they don't even read them because they assume that you use AI to write them, and therefore they're not really a meaningful document. But you still have to do them. So we'll talk a little bit about what needs to go into that. Networking means that in most jobs, the way you get on is not just about doing well in exams and stuff. It's about meeting people and sort of, you know, getting in by the back door, as it were. And that's to an extent true in medicine and dentistry, but that's way down the road for you. So we're not going to worry about that at this point. And as I said, well, they use lots of examples of ex-students to sort of make their point. So that's what you would be getting if you were to change to the mainstream thing. This is what we'll be doing. So today we'll talk about why do you really want to do this. Next week we'll just take a sort of overview of the things that you'll have to do to get offers. So a year from now, you will hopefully be going for interviews at medical schools and dental schools, and you will start to be getting offers. You may not finally get your offers till sort of April or something. It's a long, slow process, but it's about a year from now that it'll all be sort of happening. So there's a lot of preparation needs to be done in the meantime. And then we'll start to go through things in detail. So we'll talk about volunteering and work experience. Hopefully, all of you have thought about, started organising, and hopefully started doing some volunteering. That's going to be incredibly important. We'll talk about that in more detail, and particularly what you need to be reflecting on from the volunteering you've done. Then we'll talk about UCAT, and that will take several weeks to just go through all the different parts of UCAT and what you need to do to prepare for it. And then we'll talk about where you want to apply. When you do that, you can only apply to 4 places. That's the rules that UCAS has. For dentists, that isn't going to mean you have to do a huge amount of head scratching because there are only about 10 dental schools. And some of those you probably don't want to apply to anyway because they're in Scotland, and there's nothing wrong with the dental schools, but they don't like English students, so you don't really want to apply there because you won't get in. So actually, you don't have that much of a choice for dentistry. But for medicine, it's a huge choice. There are about 50 medical schools, and you can only apply to 4. And we'll talk about applying strategically, because the point I'm going to want to make is that for most of you, it's not going to be about what's going to be the coolest city to go to. It's going to be about where am I going to get in, and that's really important. And then there's the sort of stuff bottom part of that is stuff relating to interview. So the interesting thing about medicine and dentistry is that you might think, oh, what they're mostly going to be interested in is, how good am I at biology and chemistry and that kind of stuff. Actually, they couldn't care less about that. As far as they're concerned, if you can get an A and A level in those subjects, that's good enough. And they don't want to know if you're better than that. They just use the A level as their sort of measure of whether you're good enough at science. So when you go for interview, they don't ask you any science questions at all, unless you apply to Oxford and Cambridge. They just don't show any interest in the science. It's all about your personal qualities. How good are you going to be at talking to your patients? How good are you going to be at getting on with your colleagues? What's your moral compass like? What would you do in tricky situations? And so we'll talk about that and making sure that you can present yourself in the kind of way that they like, essentially, when you get to interview. And finally, we'll make sure that you're as far ahead as you can be with the application process by the time we get to the end of the year. Because when you come back in September, there's a very small window that you have to get your application in. Most of your friends will have till December to get their applications in. But for medicine and dentistry, it all has to be done by the beginning of October. So you've been back 2 or 3 weeks and that's it. So we'll try and get as much as we can done before the summer, and you'll at least be very clear what you've got to get done when you get back in September. So that's the plan for the next few weeks. So for the moment, let's focus on this question. Why, well, do you really want to be a doctor or a dentist? Have you thought about it properly? And if so, why? And if you don't have an answer to the second question, it means you haven't really answered the first question. If you've just kind of thought, well, it feels like what I want to do, you've got to be much less vague than that. And as I say, they'll quite likely ask you that at interview, and you've got to be able to make a case. Say, right, I know these are the bad things, but in spite of that, this is what I really want. And the balance works out in favour of, yes, this is what I want to do. So today we're going to focus mainly on the bad things, so that you can then, with confidence, say, yeah, I know all that, but it's still what I want to do. It's what's going to make my life meaningful or whatever. That's the plan. So just before we get started on that, I'm just going to give you a few minutes to talk to each other about that. So see if you can convince each other that you have thought about this problem and that you have good reasons to put forward for why you want to follow these courses. So if you need to move around so that you're closer to people, that might be a good plan. Right, so let's see what comes up next. So these are the kind of things that I'm going to suggest you should think about. I'm not trying to persuade you these would be better, but you should at least have thought about these as alternatives. So we'll talk about a little bit about why you might want to be a medical scientist potentially rather than a medic of some sort. We'll talk about alternative clinical roles. So that means things like nursing or physiotherapy or paramedic or radiographer, that kind of thing, which again have certain attractions. So you need to have thought about them. Even if you dismiss them, you need to have thought about them. And then other rewarding professions, well, rewarding can either mean interesting or it can mean make you rich. And both of those things are things you may want to think about. So, if you're contemplating this, you obviously have some intellectual capacity. So you could potentially become, lawyers or work for a bank or whatever and make more money more easily is the bottom line. So if you're looking at medicine dentistry because they pay well, yeah, they do, but they're not the best and they're not the easiest ways to make money. So that's something that's maybe worth thinking about. So let's start with, when I do in the autumn term, we'll have practice interviews because medical and dental interviews are scary, and if the first one you have is for real, it's not a pleasant experience. So at least if you know what to expect to help. So we'll have practice interviews in the autumn, and usually I'll ask people, why they want to do medicine or why medicine rather than medical science, whatever. And these are the kind of things people say. So sometimes they say it's, because I'm really fascinated by the biology of it, so I want a career that will revolve around that. Sometimes they say it's because I'm passionate about helping people. Sometimes it's not so much helping people as working in an environment where there are lots of people. So people will say things like, "Oh, I don't want to be stuck on my own in a lab. I want to work in a nice kind of social environment with lots of people." And sometimes, well, people don't usually say the last one because they know you don't say that kind of thing. But in some people's heads, that's probably a part of the thing that, I'm going to make a lot of money at this, and it's a secure in the sense that it has a well-defined pathway. You're not at the mercy of being promoted when you might not be promoted. That kind of thing that you get in sort of private industry. That's the kind of thinking. So we're just going to examine those things and see how valid they are. And what we'll find is that they're kind of valid. So all of them have quite a lot of truth to them, but none of them is quite that simple. So let's do the science one first. So I think lots of people will certainly say when you ask them about it that what really fascinates them is the science. So they want to become doctors because they're fascinated by understanding what goes on at the molecular and cellular level, and they're fascinated by the idea that they could actually contribute to developing better treatments for the future. So one thing that you need to know is that, which is that actually, if you look at all the progress that's made in medical science and dental science, very little of it is made by doctors and dentists. It's the great majority, the overwhelming majority of advances are made by medical scientists. And that's not because the doctors aren't capable. Obviously, on average, doctors are going to be just as smart as the people who go into medical science. But they don't have time. If you're going to be a doctor, you're going to have a list of patients that you've got to see, and if you get through 3/4 of them, you're doing well, kind of thing. So the idea that you're then going to go home after an 8-hour shift, or go away from your 8-hour shift and go and do a few hours in the lab developing new techniques, it's not going to happen. These careers are too demanding for you probably to be able to make a significant contribution to research. So that's a really important point, I think, because that's what you do need to think about. If really, really what motivates you is that you're just fascinated by the biology of what's going on, and you think, right, well, by understanding that, I'm going to be able to, find the cures for dementia or cancer or whatever it is. No, you're not, probably. Only a very tiny number of doctors actually do that. So the figures down below are sort of telling that. So this came from a survey that was done last year, where they just asked consultants how many of them were involved in any kind of research, and less than half said they had any involvement at all. And when they were asked why, they all said because they just don't have time. And to be honest, those that are involved in it, usually it's at the level of, because you know how it's going to have to work. If someone's in a lab and develops, a new wonder drug, that's great, but then it has to be tried out on people, and then the doctors have to be involved, because obviously the scientists don't have their own patients to work with. So most consultant involvement is going to be at the level of, yeah, I want to be involved in trying this drug out, and so they'll provide the patients, and sometimes they'll provide some critical input, but they're not the people driving the project. There is this tiny minority, less than 1%, of people who do manage to do both and get a career where they're spending sort of half their time dealing with patients in the hospital, and then the other half of the time they'll have a research group somewhere else nearby, and they'll go and spend time with them, and they'll contribute to both things. And I have known quite a few people who've done that, and it's incredibly demanding because you're trying to juggle two hugely demanding careers. So it's not impossible, but it's very unlikely to happen. So think hard about that if fascination with the science is what drives you. The other aspect of that, which is also true, is that if you imagine someone goes off to university and does a degree in biochemistry, say, they're going to spend 4 years studying biochemistry. If you go to medical school, you're going to be studying biochemistry and physiology and anatomy and all these other disciplines, and you're going to be spending most of your time developing clinical skills. The medical schools will teach you some biochemistry because they want you to know a little bit about why you do what you do, but it's not their priority, because their priority has to be that they're going to turn out people who can then go onto the wards. When they graduate, you go straight onto the wards in your foundation training, and you're expected to do things. And what they don't want is to be the medical school that turns out the doctors that kill people, or the dentists that accidentally drill through people's brains and things. So their priority is your practical competence. So yes, they will teach you some biochemistry, but not actually that much. So again, if you're driven by fascination with the science, you probably find medical school frustrating, because you get that feeling in biology probably sometimes that you come to a topic and you think that's really interesting, and you think, right, so we're going to get into the detail now and I'll really get to grips with it. But no, they move on to something else, because you just got to cover so much ground. You don't have time to cover things in the level of detail where you feel, yeah, I really understand that now. And it's going to be like that at medical school. So obviously, you can do your own wider reading, and there's nothing to say you can't get stuck into the science, but it's not going to be the emphasis of the course. So if you're driven by science, think seriously about that. So I'm not saying don't be a doctor, but I am saying think seriously about it, because you are unlikely to spend much of your life actually doing science if you do. And the same is going to be true for dentists. Again, obviously, there's a lot of development going on in dental work, and some of it dentists will be involved in, but mostly it's people in academic university departments and industries that are doing it. Okay, another common thing that people say when I ask, why do you want to do this rather than, say, work in a lab, and they'll say, oh, I don't want to spend my life stuck on my own working in a lab. I want to be around people. So here's just a picture. Think a little bit about that. So the top is what a research lab is like. You're not stuck on your own. You're going to be working around a whole bunch of people who are all interested in the same kind of stuff as you are. So it's actually going to be a really nice social environment. I worked in labs for years, and it was a really nice place to work, because there were lots of smart, interesting people interested in the same kinds of things, and it was a very social environment. The bottom picture is a GP. Okay, so if you think about what a GP does, yes, there are other people in the practice, but most of your day is spent shut in your office on your own, apart from the annoying people that come in with things wrong with them to moan about. And that's who you get to talk to. So I'm being overly negative, I know, and you do wonderful stuff as a GP, and you can go home and feel I've really made a contribution. But the idea that you're having a lovely social time is not realistic in most areas. And same with dentists. You're going to have your dental nurse to talk to, and apart from that, they're just going to be the people screaming in the chair. So it's not a great social experience. So again, this is not a reason to do it. The reason is that in spite of the fact that it's not great socially, you're doing something really worthwhile and you feel good about that. But don't do these things for the wrong reason. Okay, so what about the financial rewards? So we just need to talk about this. And I'm not going to be too negative about this, because doctors and dentists are well paid. Speaking as a teacher, they are incredibly well paid compared to certain professions. So, it is a reasonable choice of profession from that point of view, but you earn it. Your responsibility level is enormous. If as a teacher I tell you something that isn't quite true, well, it's not going to ruin your life. But as a doctor, you can kill people. Hopefully, as a dentist, you don't kill too many people, but doctors do. Because when you make mistakes, bad things happen. It's an enormous level of responsibility. And that's what justifies, I think, the financial rewards. So yes, you're going to be well paid, but there are easier ways to make that kind of money, I think. So let's just have a look at the numbers. So this is a sort of medical career path. So these are quite up-to-date figures. So it starts bottom left there. So if you don't know this, the way it works is you'll go to medical school for 5 or in some cases 6 years, at the end of which you graduate and you're then a doctor. But you don't have any level of independence at that point. You have to then do 2 years of foundation training, which means that you go sometimes to one hospital or sometimes to several hospitals, and you do 3 specialities each year. So over foundation, you do 6 specialities, and that basically gives you enough experience so that you can then make an informed decision about what you want to specialize in. Do you want to be a GP? Do you want to be a cardiologist? Whatever. But they make you do 6 different specialisms so that you don't just jump into something without thinking about it. And at that point, you already have quite a lot of responsibility. you know, you can be on your own in a ward in the middle of the night, and something goes wrong, you've got to do something about it. And that something might just be to make sure that you call the experienced experts in, but it's still your responsibility. So it's a responsible job. But at that point, you're not that well paid. You pay 40 odd thousand, and you can get much better starting salaries in industry for various other things. But it does get better. So junior doctors at the bottom end, that's not a great salary. But once your 2 years are up, you're eligible to apply for core training, which is now you've specialised in a particular area, and that will take 3 or 4 years depending what you're interested in. And if you manage to progress straight from foundation to core training, that's a fairly quick route up to about 70,000 a year. But we'll talk a bit more in a minute about the fact that that's not quite as straightforward as it seems. Core training takes say 3 or 4 years, and then you become a registrar. And then again, it depends on the discipline. Some years you may only have to spend, another 3 or 4 years as a registrar, and you have a chance of becoming a consultant. But if you want to be a brain surgeon, it might take you a dozen years. For really competitive things like that, you can spend an awful long time before you reach the top of the tree. Once you do, you can see those salaries are huge. Consultants will typically earn, 150k or so, and that's just in the NHS. If you choose to do private work, you can earn more than that. GPs, interestingly, even more, that they get paid better than consultants. So it's a progression, and it starts at a point which is still better than most graduates will start, but your responsibility level is much higher, and it ends up really very high. If you go into private practice, you can earn much more than that, but hopefully you won't, because that's what it's meant to be about. Okay, what about dentists? Well, it's kind of similar. Starts about the same level, slightly higher pay at the beginning than doctors have, but around the 40k mark. And as you progress, it increases. It depends what kind of dentist you become, but you can end up with really quite respectable salaries, particularly if you become a sort of specialist, and we'll talk a little bit more about that in a minute. So yes, it is good money, but you have to work really hard, and you have to accept a lot of responsibility to do it. I think that in the junior years, dentists have a better deal than doctors do, because as a junior doctor, you will have to work all kinds of hours, and you're sort of at the mercy of the administrators. So one of my kids, for example, is currently in core training, so just the level above foundation training. And he phoned up and said, "Oh, I'm going to be able to come home for Christmas." So he said, "Oh, that's great, that's really exciting." But what he meant by that was that he was working till 2 a.m. on Christmas morning, and then he was going to drive to us from Nottingham to spend Christmas Day, and then he had to leave at 5 o'clock in Boxing Day morning to get back there to be on shift again. It's a tough life. Another one of his friends, he had to swap a shift with, because the administrators, he'd said to the administrators, I don't want to come in this day because I'm getting married. And the administrator said, "Oh, tough, you can't get married, we need you that day." And the only way he was able to attend his own wedding was by persuading someone to swap a shift. Yeah, it's not easy as a junior doctor. Dentists tend to be a bit more civilized than about things, because most, with very few exceptions, dentistry is done during normal working hours. So if that puts you off, it's worth thinking about dentistry, but it's getting hard to get into dentistry. I think for that reason, because there's been so much publicity about the tough deal that junior doctors have, that quite a few people thinking, well, maybe I'll be a dentist because it's a little bit less stressful life, but it is only a little bit. So what about the trends in pay? Because it's one, that was just a snapshot of what people are paid now. But what you want to know, of course, is, well, yeah, but what's it going to be like in 7 years' time when I start getting paid? And you can't tell, because what that graph, that's just a mess, but what that's showing you is that salaries just jump around all over the place. Because particularly in medicine, you're being paid by the government, and basically how much the government pays you very much depends on you know, where they are in the electoral cycle and how the economy is doing and this kind of thing. But what that shows you particularly, so this is like percentage change. So top left-hand corner is for all these different kinds of doctors, this is the sort of reference point, which was 2010. And the graphs are then showing what's happened since then. And you can see that for all levels of doctor, you're now much less well paid than you were in 2010. That's in real terms. Obviously, you actually get more pounds per year than you did then. But if you adjust it for inflation, you're much less well paid. So again, you know, it's not encouraging if you're doing this for the money, because the trend is going in the wrong direction. But it varied a lot. I mean, it got terrible in the sort of extreme sort of meanness period in the early 2020s, when it, you know, when it was all about austerity and stuff. And so you can see that the salaries got so bad to the point that an F2 foundation doctor was paid 20% less in real terms than they would have been in 2010. And when the present government came in, they said, right, well, we've got to do something about this, and that's why you got this sharp upturn. We know that the doctors got a huge pay rise when the present government came in. But yes, it was huge, but it still didn't take them, most of them, anywhere near to where they would have been in 2010. So you've got to be a little bit worried that yes, you're going to be well paid, but it may not continue to be quite as well paid as it is now, depending on what the trends go. It's really going to be hard to predict. This is an even more incomprehensible graph, which I don't want you to think about in detail, but it's just compare a couple of the lines there. So the orange line near the bottom is a consultant in the UK, and looking at what's happened to their pay since 1980, and you can see it's gone up steadily, you know, with that dip, and then the recent sort of rise at the end there. So that's the orange line there, and then if you look at the dark blue line in the middle there, that's a lawyer in the UK. So not an absolute top lawyer, just a lawyer working for a reasonable sized firm and at quite an advanced stage. And you can see in 1980, those people would have been paid a bit less than consultants. Today, they're paid 50% more than consultant doctors are. You can see what's happened. That yes, doctors are well paid, but when you compare it to some of these other professions, they're falling behind. So in 1980, the doctors would be living in the posh bits of town next door to the lawyers and the bankers, and not so much today, because it's just the lawyers and the bankers. The doctors have sort of moved down a little bit. It's not terrible, you know. They're still not living in the slums with the teachers, but they're you know, it's not as good a deal as it once was. So don't do it for the money. That's what I'm saying. It is going to be okay. You're not going to have to worry about money, but you're not going to get to that point where you just thinking, right, I'm living this life of luxury and it's not costing me anything. A lot of responsibility, a lot of hard work, and not as much money as you could make doing something else. This one just makes that point in a slightly different way. So this is a graph where basically the intensity of the color tells you how well people in that profession have kept up with house price inflation. So in other words, your ability to pay for somewhere to live. So you can see the mid-career lawyers are doing really well. Right, they've got a really dark green band there, which means that their ability to pay for their house has pretty much kept pace with house price inflation, which has been terrifying in the last 30 years. But their salaries have increased up with it. And doctors have this feeble pale green, meaning they've fallen way behind. So yeah, it's good, but it's not that good. That's the message. Right, let's talk about career progression then. So if you talk to old people like me, most of them will say, oh, the great thing about being a doctor or a dentist is once you get into the medical school, you're set for life. You know, it will just progress without any difficulty from student to foundation doctor to trainee to registrar to consultant. And you know, unless you do something awful, nothing will stand in your way. And that used to be true. It was just a very smooth progression, but it's not true anymore. So that's what that diagram kind of makes you think that you just sort of gradually move up the pay scale like that. But this is the reality. So what this graph is showing you is this is looking at people who've done their foundation training. So those first 2 years of being a doctor after you graduate. So they've done that and then now decided what they want to specialize in, and so they're applying to get into that speciality training. So the worst case here, the worst case is psychiatry, purple line. And you can see that in 2016, so not that long ago, if you wanted to be a psychiatrist, you were faced with the problem that when you applied for specialist training in psychiatry, there were about 3 applicants for every place available. So it was quite competitive. And what it meant was that not everybody got in, obviously, at the first attempt, and they would sometimes have to get some kind of, low-level general doctoring jobs in hospitals for a year or two, but then they would get into core psychiatry. And so it was annoying, but it wasn't a big problem. But you can see what's happened in the last few years is that now instead of 3 applicants for every place, there are 22 applicants for every place. So if you want to be a psychiatrist, you're faced with the problem that you've got to be the best one out of every 22 people applying for that thing. And that's a nightmare. And I mean, it isn't quite as bad in other things as you can see, but even the best of those, it's sort of around 5 or 6 applicants for every place. So that means that this is no longer a smooth career progression. And you've got to be aware of that you are going to have to think, okay, I may not get to the levels I'm aiming at, where I'm doing the really interesting stuff that I'm hoping to do straight away. So you might do your foundation training, and then you might have to spend 2, maybe 3, maybe even more, who knows what's going to happen, years just turning up, being the person on the wards, not necessarily developing your expertise very much, before you manage to get onto core training. And that's a real worry. So the government is kind of aware of that, and they're making a lot of noise about, oh, we're going to sort this out. But at the moment, that's all they're doing, is making a lot of noise about it. They're actually sorting it out, but hopefully they will do, and that will become less of a problem. But I just want to make the point that don't listen to the people who say getting into medical school is the only thing. After that, you don't have to worry about it, because that's not true. There are just some actual figures from last year just to make that point. So overall, 33,000 people applied for just 9,500 places. Consequence was at the end of F2, so at the end of foundation training, 52% of doctors didn't have a proper job to go to. So they would then be scratching around looking for work here and there in hospitals. So yeah, it's tough out there at the moment. And part of the issue that you have to be aware of is that you're not just competing with all the other people who've been through medical school with you and stuff like that. Because in this country, we take the view that we ought to make our training available to everyone from anywhere in the world. And very few, almost no other countries do that. So, if you train in Germany, that their specialist training will only be for German students, unless they've got places left over, and then they might hand a few other ones out. But here you compete on equal terms with everyone from everywhere in the world. So of course lots of them want to come here, and that makes it really, really competitive. So it's not an easy environment. Dentists, it's not as stressful, and again, it depends on what your ambitions are. If you want to become sort of a high street dentist, just doing general, that's the word I was looking for, general dental surgery, then you go through this process where you graduate, and then you don't have a sort of organized foundation program like you do in hospitals. You go straight into an actual dental practice somewhere. But they will train you. So your first year, particularly, you're in foundation training where there's a lot of time spent learning stuff. And then core training where you're doing much more actual dentistry, but you're still having to do some learning programs on the side. But all this time, your salary is increasing steadily. And after 3 years, you can become a fully fledged, general practitioner on the high street. So it's much quicker than it is for doctors. If, however, you want to be a specialist practitioner, so for example, if you want to be an orthodontist, they have to have really specialist knowledge that most general dentists wouldn't have. And that's where it does get more competitive. So getting onto a speciality training program to become an orthodontist, or someone who specializes in particularly difficult areas of surgery or whatever, there again you have to put up with the fact that you may have to apply lots of times before you make it into that. But if you want to make the big money, or do the most surgically interesting things, then that's what you have to aim at. So again, it's a smoother career path than it is for the doctors, but it's not totally sort of plain sailing. There isn't, however, an unemployment issue with dentistry. There's a big shortage of dentists all over the country, so you don't have to worry about, will I not have a job at all, as sort of people in those early stages of medicine do at the moment. Okay, so financial picture is okay. The career progression does happen. I'm not trying to say don't do it because you'll never get a job. I mean, people do get a job in the end, but it's not always as easy or as painless as you might hope. A couple more reasons just why you might want to think twice. One is that the sort of status of doctors has changed, because it used to be that they did all the cool stuff and everybody else kind of picked up the pieces around them, and that's no longer the case. So lots of the things that used to be the sole province of doctors, now other professionals do. So for example, you can get, if you go and become a nurse, you can then train to become a specialist anesthesia nurse and basically do what, in routine operations, what anaesthetist doctors used to do. Of course, the doctors are not happy about this because it's threatening their position. Pharmacists used to just hand out the medications that doctors prescribed, but now pharmacists can prescribe themselves. Not the really dangerous, powerful drugs, but some drugs they can prescribe themselves. So again, doctors' position has been weakened, and it means that if you did contemplate some of these other professions, and we'll sort of put a list of those up in a minute, the prospects for those people who aren't doctors but are sort of in the allied health professions are actually more positive than they used to be, because there are opportunities there that didn't used to exist. Again, you've got to think about that. That's happening to a lesser extent in dentistry, but there is now a thing called dental therapy, which you can do, which doesn't require the high hurdles that you're going to have to get over to get into dentistry. For example, you won't have to do the UCAT exam if you apply to do dental therapy. But you can get a qualification that enables you to do routine dentistry things like fillings and stuff like that. But you won't get to the high level. That's the thing. So you have to decide what your ambitions are. But yeah, there are changes in roles there which might make you want to think about other things. If you're contemplating dentistry, the state of the NHS in dentistry is something you need to really think about, because it's at death's door, basically, NHS dentistry. Because the successive governments over 30 years have failed to find a good way of paying dentists to do NHS work, and dentists have just decided that they're fed up with it. So the majority of them have said, we're not going to treat NHS patients anymore. So it's now, as you may have encountered yourselves, very difficult to find NHS dentists, and impossible in some parts of the country, because all the dentists say, no, we only do private work now. So again, there are two sides to that coin. You tend to get paid better if you're doing private practice, but you have to face the fact that there are going to be people out there who need dentistry and can't afford private fees, and therefore end up with their teeth falling out because they can't afford a dentist. It's a disaster in the process of happening. So you need to know about that if you're contemplating dentistry, because you need to know what's happening. The government's talking about compelling new dental graduates to actually work in the NHS for some years at the beginning of their career. which is all very well. I mean, it sounds slightly Stalinist. I'm not sure if I really approve of it, but quite apart from that, how's it going to work if all the dental practices are doing private work? How, you know, where are these people going to do that? So, you know, we'll see. But inform yourself about that. If that's news to you and you're interested in dentistry, find out about the NHS crisis. And finally, just to reiterate that these are stressful professions because you have to work long hours, unsociable hours when you're a junior doctor, not so much when you're a dentist. But you know, when you're a dentist, you get to the point where you sort of own the practice, and then you have to worry about the whole money side of it as well as the sort of medical side of it. So there are lots of reasons why both of these things can become stressful. So you know, factor that into your decisions. That there are jobs where you have less risk of burnout, less risk of sort of stress-related health conditions. But actually, there aren't many sort of jobs where ambition goes along with it, which are less stressful. In other words, if you want a highly paid job or a job where you are doing something really interesting, they all tend to be a little bit stressful. So, you know, there aren't too many obvious alternatives to point to where the stress is lower, other than say things where you're just not aiming that high. And it's certainly not the worst. Depends which data you look at, but the most stressful job on most things I've looked at is social work, which is incredibly important and not well paid, not well regarded, but unbelievably important. And burnout rate in social work is terrifying. Okay, so what other roles might you want to think about? Well, you know, all kinds of things, but physician assistant is worth mentioning. Physician assistants are people who don't do medical degrees. They usually do some kind of biological sciences degree, but some of them don't even do a science degree. And then they do a 2-year training course, like a master's degree. And after that, they can basically do what junior doctors do, most of the things that junior doctors do. And they have much less training, but because they're only doing a limited range of things. Okay? And they have much less responsibility because they're always acting officially in a role where they're assisting a consultant. They're not taking responsibility for their own job. So it's a way of getting to do the caring for people in a hospital or to an extent in a GP practice, although that's gone kind of out of a bit, without needing to go through all the stress of applying for medical school and stuff like that. Not clear what the future is for those, because again, doctors hate the whole system because it's cutting their feet from under them to an extent, and they've campaigned very hard to stop the sort of growth of the physician assistant thing. But it is a possible way into healthcare, particularly if you conclude at some point you're just not going to make it into medical school. Then it's a possible way of getting in and still caring for people, still doing those things without needing to be a doctor. As I say, to an extent, dental therapists, the same applies in dentistry. Nurses, much more interesting jobs than they used to have. So again, think about that. And then there are all these other allied health professions. And it's important not to minimize the huge level of expertise and skill that these people have. One of the things that doctors frequently get accused of, and some doctors in my experience are certainly guilty of, is extreme arrogance. And you know, that is portrayed often, I mean often unfairly, because it's all different just like any other profession, but some doctors do tend to kind of think that they're the sort of people operating on a higher plane than everyone else, and that they could do all these other jobs if only they had the time. And it's not as simple as that. You know, you show most doctors an MRI of a brain, you know, from someone who's got some brain problem, and they'll be able to identify that it's a brain, and that's about it. The people who can spot the bit that doesn't look right are the radiographers. So it's not that they're just doing the stuff that the doctors, you know, the routine stuff that doctors don't have time for. They train and develop an expertise that doctors just don't have. And you know, the same applies to all of those things. And speech and language therapy, for example, is incredibly interesting. You know, when people have strokes and they can't talk anymore, how on earth do you teach someone to speak again who's, you know, in their 50s or 60s or something like that? And that's what these people learn how to do, and that's a whole skill set that doctors wouldn't have a clue about. So don't just rule out these things as sort of secondary things that don't really have much skill attached to them. They have enormous skills attached to them, and they're worth contemplating as alternative careers which are easier to get into and generally um, tend to be 9 to 5 jobs, so you don't get that quite so much um, interference with your sort of work life balance. So lots to think about.